How do you stop plaque attacks?
Brush, brush, brush. So it's, again, if you brush once every 24, now the magic number is 24 hours, and flossing once every 24 hours. That's pretty well the minimum. Plaque is soft and sticky, but it can be taken away with a toothbrush if it's not left more than 24 hours. After 24 hours, it gets a lot more adherent, a lot harder, and it has to be scraped off. We used to say flossing once a day is enough, but now we're saying 2 times a day is way better. So, and it's best to do it before you go to sleep, because when you're sleeping, your saliva flow reduces. Otherwise, we'd really dribble in our sleep, drool, and so your mouth gets fairly dry, and then the plaque does its most damage, and the tartar that develops from old plaque. So, if you're the kind of person that doesn't feel like brushing or flossing their teeth before they go to sleep, then do it when you wake up, or do it after dinner when you're watching TV. Just sit there and, hope nobody criticizes you too much. Just tell them, this is the time I feel like brushing. You can even floss watching TV. The thing is, to get it done, the whole process takes just a few minutes if you do it really conscientiously. So do it. It'll keep you healthier and happier. Also, your saliva and breath will smell and taste a lot better.
Which is better, a manual toothbrush or an electric one?
Well, better is depending on who's doing the definition. A manual toothbrush is good enough unless you have arthritis or another disability. But it's like cutting wood, or with a manual saw, or using a regular screwdriver. If you get a power saw or a power screwdriver, you'll do a faster job. So if you're lazy or have stiff wrists or funny fingers, get an electric toothbrush. Or if you just like to have power tools, get an electric toothbrush. An electric toothbrush won't hurt you. It won't do a better job, but it will do a faster job. So even the electric toothbrush, we suggest 2 minutes. So the manual toothbrush in 2 minutes will do as good a job within, depending on who's measuring, it's the same. It's the time spent moving it around.
What kind of toothpaste do you recommend?
Any toothpaste with fluoride. Now, people, if they're into this, will say, but fluoride's a poison. Yes. So is table salt. So is water if you drink enough of it. Fluoride in controlled amounts is a necessary nutrient. It's a naturally occurring mineral. It's in tea. Any tea you drink will have higher fluoride in it than most other vegetables. Now the reason I say this is that since the 60s, since fluoride has been added to toothpaste, and I'm not going to get into putting fluoride in water, but fluoride in toothpaste, the incidence of tooth decay worldwide, whether there's fluoride in the water or not, the decay rate has dropped to almost the same. And it's the fluoride in the toothpaste. It stops decay. It makes bones harder and stronger, which unfortunately, when you get elderly, these hard, strong bones are more brittle, just like glass, and they are more likely to break. But this is not like a significant thing. If you fall hard enough to break a bone that's got a lot of fluoride in it, you'll probably break a bone that doesn't. So I'm not sure that this is significant, but it is something that does come up. Even the natural toothpaste, nearly all of them now have, one of their formulas has fluoride. Of course, they always provide a toothpaste without fluoride. In my practice, the people who use toothpaste that do not have fluoride, and they're hard to find, seem to have more decay than normal. So people will say, well, it's only my teeth. Well, yeah, it's only your teeth, but you use them every day. They add to your health and pleasure in life. And fluoride has been in toothpaste for 50 years, and there has been no indication that it's any kind of problem. Now, with small children who don't rinse and spit and rinse and spit, there are children's toothpaste that have a much, much lower level of fluoride, and because they may swallow it. So I wouldn't use normal adult toothpaste on small children, unless children are under the age of 6, or 6 to 8, depending on your child. If you don't trust them that they're spitting it out, because toothpaste tastes pretty good, and some children will swallow it, they won't poison themselves, but what will happen is, if they're getting too much fluoride, and usually it's from eating toothpaste, around the ages of 2 to 4, they will end up with either white or brown spots on their teeth. And this is very variable. It varies with the individual child. There are cases of twins who one of the children has fluoride spots and the other doesn't. Now you have to assume they both swallowed the same amount of toothpaste. Impossible to measure. So it happens to some people with less fluoride than with others. So a little fluoride is really good. And again, with a child's toothpaste on a child's brush, just a smear is enough. You don't need to use the pea size, which they tell you on TV. Just enough so there's some fluoride. Because the fluoride is absorbed, and that's enough. You know, you get enough from the time.